Welcome everyone to today's webinar, The Post-Call Center Era, How Intelligent Automation Can Reduce Call Volumes and Increase Patient Satisfaction. On behalf of Becker's Healthcare, welcome and thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log in to today's webinar to access the recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box, and we are here to help. At this time, it is my pleasure to introduce our presenter, Bree Buck. At Notable Health, Bree leads solutions development in patient access and digital engagement, applying automation and AI ML to transform how patients get care. Bree previously served as a consultant and strategic advisor to over 20 leading healthcare organizations on digital health transformation and digital front door strategy. Prior to this, Bree worked at Epic Systems, leading EHR installations around the globe. She was integral to the debut of Epic's Predictive Analytics Suite, launching the first 5 AI analytics models for Epic customers and training internal teams on commercialization and deployment. Bree holds degrees in public health and economics from the College of William and Mary, a master's degree from the London School of Economics, and a certificate in managing innovative technology from the University of Oxford. So without further ado, I'll pass it over to Bree.
Good afternoon and welcome to today's webinar. I'm pleased to introduce our topic, the post-call center era, how intelligent automation can reduce call volumes and increase patient satisfaction. Now today, we'll be covering a couple topics. First, we'll be talking about why the call center must be reimagined to meet today's patients and consumer needs. Then we'll move to what it looks like to bring a new approach and new thinking to optimizing the call center. Then we'll look at some best practices for how to get started and see some examples throughout a case study. At the end of this session, we'll leave a bit of time for Q&A as well. Allow me to introduce myself. My name is Bree Buck, and I lead solution development in patient access and digital patient engagement here at Notable Health. This means I work with hospitals and healthcare organizations across the country to apply novel technologies like automation and AI and machine learning to help patients access care and providers get paid. Over the course of today, I have 3 main learning objectives for this presentation. The first is that we'll review and align on the role of the call center and understand how current market forces are affecting operations. Next, we'll talk about some common challenges that partners are facing. And then we'll look at intelligent automation and how it can assist in transforming contact and call center operations. And lastly, we'll discuss best practices for introducing automation to support patient access workflows. So without further ado, let's get started. Let's first talk a little bit about why the call center must be reimagined to meet today's patient, staff, and organizational needs. And before we do this, let's align on the critical role that the call center plays in healthcare operations today. According to our partners and research across the market, there's 3 main buckets that the kind of core functions of the call center is covering. The first is to manage things like inbound requests. So oftentimes, call center representatives are serving as the switchboard operators to triage calls to the appropriate provider, department, individual, or patient room. The second is typically to support clinical care by powering things like nurse advice lines, disease management programs, marketing campaigns for health programs, and more. And lastly, call center staff are assisting to perform administrative and back office tasks. These are things like scheduling, registration, billing, and collections that support the patient journey. And zooming out, we know that historically, call centers came about for a few reasons. Healthcare organizations often saw call centers as, one, an opportunity to standardize with all activity completed by a dedicated team within the organization. Two, they were brought about to more effectively manage things like phone communications with patients. And lastly, to save costs by creating a centralized resource across the organization. However, increasingly what we've seen is that call centers are becoming the last line of defense in healthcare, where staff must handle all requests that cannot be solved elsewhere. And oftentimes this is over an increasingly complex web of chat and communication tools with things like social media, texting platforms, and more. And we're finding from our partners that current staff who are hired into a patient service or a call center representative role are managing more than 8 to 10 tools to complete discrete patient requests and workflows. So with that in mind, let's take a look at what are some of those common challenges we're hearing from our partners and across the industry. The first challenge across all the organizations we talk to is difficulty with staffing. And what we're hearing by and large is that there's an increase in the cost of labor. We're feeling the kind of pressures of inflation. And at the same time, there's a decrease in staff levels. So labor costs, as we know, are rising due to inflation. And from about the same time last year are up at least 14%. And in many parts of the country are up more. And at the same time, there's a 5% decrease in staffing levels. So with many of the call centers that I talk to week, there's consistently around a 10 to 30% vacancy rate. And that's the norm. That's a kind of baseline that organizations are operating from. So simply put, organizations are needing to maintain levels of service, support net new patients coming into the system, and manage increasing complexity, all with decreased staffing levels and high turnover rates. And what we also see with those turnover rates is that it's increasingly expensive to replace employees as well, up to half to 2 times of the salary just to fill or backfill a position. The next thing we're hearing is evolving patient expectations. So we're hearing challenges in growing patient preferences for digital and self-service options to manage care. And I'll go a little deeper on this later on. But what we know is that patients desire consumer-grade experiences, the same experiences they're getting when ordering a package off Amazon or using Walmart Plus. And they're willing to seek care elsewhere if that consumer-grade experience is not available. One study from Healthcare Consumer Trends reported that in choosing providers, consumers preferred by a 4-to-1 margin to see a provider with less availability and online scheduling over one with greater availability and without online scheduling. So simply put, patients, even if they can't get in to see a provider as soon, they would prefer to use and see a provider who had self-service and digital options. The next main problem we're hearing is around outcomes misalignment. So as we've talked about, organizations are needing to manage ballooning costs, meet consumer expectations, and all of this is leading to tensions within the system. We know that operating margins for healthcare are down across the board. And in January of 2022, operating margins were down 73% as compared to 24% at the same time last year. And while revenue growth is a top priority for health systems, they must also balance the need to improve the quality of engagement with patients. And to that end, another key challenge we're hearing from organizations is around patient routing. And we know that it's increasingly difficult to match patient symptom to the appropriate provider, location, and specialty for care. And managing increasingly complex customer service channels, as well as increasingly specialty and subspecialty care, lead to oftentimes the patient ending up at the wrong office or with the wrong provider, and thereby creating problems in patient satisfaction. This is often happening because of difficulty in managing digital tools, and as they mentioned, increase of different customer service channels and increasingly specialty and subspecialty care. So as we move forward, and I mentioned, we'll double click on how call centers have been influenced by growing consumer trends. We know that several studies have shown that patients prefer digital experiences over phone calls. So for example, 61% of young patients would consider switching providers over a poor digital experience. And we know also that 20% of patients have given a negative review because of a poor digital experience. And half of patients will say that a poor digital experience will ruin their care journey with their provider. And one comment we often hear is that while this is true of younger demographics, older patient populations aren't interested or engaging in digital. However, more and more research tends to show that the inverse is true. For older adults who are engaging digitally, they actually use digital tools at rates that exceed younger adults. And in my own work with Notable, we've measured rates of digital adoption for healthcare, and older populations tend to engage in similar levels as younger. The data do show some small variations based on time of day they engage, but in general, older generations are interacting at comparative rates. So based on all the information, all of the consumer trends, we can see that patients desire multiple channels, including digital and self-service, to manage their healthcare needs. And of the role the call center plays in healthcare, the most critical is that it's the patient's first impression of the organization and practice. And at a time where healthcare organizations are seeking to increase net new growth and retain current patients, the call center cannot be ignored. And on the other hand, due to shifting market forces, call centers alone are no longer the front door to the health system. The status quo is unsustainable. And if you go to the next slide, due to changing consumer expectations, the impact of digitization on the workload, and increasing staff vacancies. But the current situation also presents an opportunity. We know that the call center has historically been a driver of patient retention, patient satisfaction, and patient loyalty, and that in the future, it can also be a partner in an improved care outcome. There's a direct ability to increase access to care, patient acquisition, satisfaction, and retention through reimagining the call center. And furthermore, envisioning a new future for the call center can lead to increased operational efficiency and reduced costs. So with that, I'd love to look at and move into what's happening today and to what the future could look like. I'd like to take a look at how intelligent automation can provide a new approach to optimizing the patient experience and reimagining the call center in the way patients access care today. Before we talk about automation, I think it's important to understand the technology that individuals and organizations are using to enable patient access in the call center today. And oftentimes what we see is that organizations introducing technology do so to make their agents more efficient or to provide more channels for patients' communication. And these types of technologies have actually failed to drive demonstrable change in organizations. What we know is that typically what happens are just incremental productivity gains, but this on its own does not enable transformational impact. For instance, a CRM makes agents much more efficient, but it's not changing how patients have to engage with staff. They still must call in to talk to the agent. And IVR might improve agent productivity, but it also tends to create lower patient satisfaction and frustration in accessing care. And things like chatbots might allow patients to manage their care in a different modality, but they still require manual intervention and are simply switching the modality of interaction without redefining the underlying workflow. So all in all, we know there's many technologies that have enabled the call center, but as mentioned before, call center agents are now needing to switch between 8 to 10 of these technologies. And while they're making us more efficient, they're not making us more effective at meeting patient needs. And to that point, what we often see as these new technologies are introduced is that certain workflows have optimized for one constituency, while others are made worse. And certain groups have an improved experience in the healthcare system, while others have additional work added. So as you can see in this example, a patient is using many different technologies to interact with the system, but on the back end, the staff has additional work and points where they must act on that patient's account or request in order for the patient to actually be seen. And this is not new, right? And we typically notice this dichotomy where maybe one constituency has a better experience, but the others have a worse or are given more work based on that. So with that, I'd like to talk about how we could truly reimagine the role of the call center and how technology can play a role in that. So instead of technologies that make agents faster or look to improve efficiency, we should be reimagining the role of the call center to automate the work away entirely. A reimagined call center moves from a reactive and undifferentiated experience to a proactive and differentiated experience. Where currently healthcare organizations rely on patients to seek care, a reimagined call center will provide things like self-service, automated digital engagement, which eliminates the underlying manual work that an agent needs to perform. And where current workflows are undifferentiated, meaning a patient receives a generic repetitive experience that increases patient frustration, a future system will provide a differentiated patient experience with a personalized high-touch engagement across in-person and digital channels. And this example leads to things like improved patient acquisition and retention. So when we talk about reimagining the role that these centers play in healthcare, we want to move from these manual and reactive centers that field patients' requests and are kind of the last resort or last stop for patients to get their queries answered. We want to move to a personalized digital patient experience. And to truly make this vision a reality, new technology and a new approach to patient access is needed. But this also includes a new paradigm or a paradigm shift. Instead of thinking how technology can increase agent productivity, we need to think how to eliminate calls upstream altogether. In the old way of thinking, organizations sought to improve these current processes, but in the new way, we need to fundamentally redefine the relationship between patient and healthcare provider. Where the former looks to create marginal increases in productivity and has a minimal impact on patient experience, the latter will translate to substantially reduced operating costs and a transformational impact on how the patient and staff experience the work today. So what is the underlying technology that can make this possible? This includes building blocks like artificial intelligence, which determines what and how to perform call center workflows in an automated fashion and how to improve them. This also includes things like RPA, which performs automated workflows by clicking into EHR fields, typing notes, or uploading documents, just like an agent would. And as part of this, omni-channel patient engagement is needed, which empowers integrated digital communication across any modality. And also because we know that healthcare workflows are highly variable, technology is required, or any kind of technology requires custom configurability, which enables governed development of custom automations to meet the unique needs of different specialists, payers, and other constituencies. These layers, which include patient-facing engagement, integration, and intelligence, coupled with configuration tools, will assist healthcare organizations in building the workflows they need to successfully automate out the manual, repetitive work that agents are doing today and allow them to focus on higher value tasks. So let's look at some examples. We know that the majority of call center workflows are made up of discrete workflows, such as scheduling, registration, and processing authorizations today. These are just some of the kind of core categories that we hear from our partners, and make up a majority of what patients are calling in about. Now, in the example of registration, for instance, We know that typically what happens is we need to collect certain information from the patient in advance of their visit. And oftentimes we're collecting some of this at scheduling, some as part of a pre-reg team. And in other cases, it's all being collected at the front desk. Now, in this example, we could use AI to scan the patient's record in the EHR and determine what information they need to complete prior to reaching out to them. We can then configure and send a personalized digital conversational intake via SMS or email, have the patient fill that information out, and then leverage digital assistants to automatically populate the EHR with data collected from the patients. So that's one example where instead of needing a pre-registration team that's now placing, thousands or hundreds of calls a month, instead we can automate out that work entirely. And this is possible too for areas like scheduling, authorizations, and other kind of core workflows that exist within the call center. And we know that there's thousands of workflows today where this technology can be applied, but a core principle in effectively reimagining the call center lies in best practices when applying automation. So with that, I'd love to talk about some of the best practices that we've found that I would recommend using when looking to automate your call center. So I'd like to leave you with 3 steps that you can use when thinking about engaging this work. In order to do this, the first is an analysis looking at what are the highest ROI workflows to automate. And typically we know there's some strategic KPIs to optimize for within this area. Things like agent and staff time saved, number of inbound and outbound calls reduced, things like reduction in mean time to resolve, error reduction, and then growth in net new patients to the system. And one of the things we found with our partners is that oftentimes by eliminating work in one area, other areas are freed up. So for instance, if we look at number of outbound calls or inbound calls reduced, that's then going to directly lead to a reduction in mean time to resolve or time to first answer. So as part of this experience, this process, we first need to look at what are those highest ROI workflows. We then need to look to implement supporting technology and then apply an agile way to measure impact and iterate on the approach. So let's talk first about how to define highest ROI workflows and look at what exactly to automate within your call center. When we talk about defining the highest ROI workflows, what we recommend to our partners is to first perform an analysis of all current inbound and outbound call volume, segmenting out different types or reasons for high volume calls. And some organizations track this, some will need to kind of start tracking or logging what different calls are for. But typically we're looking for large segments of calls that we know are coming in consistently month over month. We then want to look at the total time spent on each type of call as a general proxy for potential ROI for automation. So we oftentimes will look and see that for some calls, staff are only spending 30 seconds to a minute looking to answer it. Other calls are 10, 15 minutes long. And then as a kind of third step, we want to assess what % of current call volumes could be reasonably automated. And then a couple other things that we think about are, is it something that could increase patient satisfaction, right? Is it something that will show up on our Press Ganey at the end of the year, or that we know is something patients have called out as a pain point? Does it increase access to care? Does it help patients get in sooner and keep them within the system? Does it reduce costs? And can it be more effectively handled via automation? If we go to the next, there's a couple additional factors to consider that we typically look at as part of the defining the highest ROI values to automate. These are things like, what is the complexity, right? Can this task be broken down into repeatable and standardized steps? And how easy or difficult is it to train an agent to effectively perform this task? We also look at patient impact. How much value does a human touchpoint add or subtract from the interaction? And oftentimes, call center representatives and staff within these centers are spending a lot of time on tasks that take, that are continuing over and over again, but don't add a lot of value to the patient interaction. Things like those administrative and back office tasks. We think of things like appointment reminders or payment collection. Then we typically consider things like cost of error. How much value is lost when an agent makes a mistake? So as I talked about earlier, routing the patient to the inappropriate provider who's maybe 3 months out, right? And then the patient has to start again. That's a very frustrating experience for both the patient and the provider. And then things like, we know oftentimes back-end denials that need to be worked, or potentially avoidable write-offs are, often caused by front-end registration errors, and these lead to further downstream costs. And then lastly, what is the difference in performance? We know that when applying AI, there are some tasks that human or computers have, more processing power and can do something more effective. Things like, AI knowing better what payer and what plan are related to an insurance card than a human can know. And how much more or less effective can the workflow be performed by a person versus an automation? So moving forward, what we now see is that based on looking at those highest ROI opportunities, we can then recommend different solutions and areas to start with automation. If you go to the next slide, this would be an example of what this analysis would look like for your organization. We first break down in the left-hand column, what is the call reason? Why is a patient calling in? And these are, broad categories, but this, analysis can be done with some more kind of segregated categories as well. Then we look at and quantify what is the time spent by agents to answer this call? What is the complexity of the call? What is the patient experience impact? And then what is the revenue impact? And from there, we can identify certain areas that are the best to start in terms of looking to automate. You can see here, registration and appointment reminders are great high value areas for this organization to begin to automate work out that is currently being performed by their call center. And after your organization has found the highest ROI workflows to automate, the next 2 steps are to then implement supporting technology and then measure, impact, and iterate on the approach. So typically this looks like an agile methodology to first start to automate a subset of that workflow, begin to configure to the specific nuances, launch the technology, have patients use it, and then measure impact on those strategic KPIs and iterate based on that approach. See when patients are interacting, when the workflow is reducing downstream denials, and iterate to really make a difference in automating out that core workflow and then also achieving the ROI. So with that, I'd like to go into an example of what this looks like for one of our partners, and then talk a little bit about a case study we saw. So initially, in this example, we worked with a call center to perform an automation assessment and found that over 70% of their calls coming in were due to scheduling, rescheduling, and cancellations. If you go to the next slide, what we then found was that only about 1% of visits today for this call center were initiated through outbound scheduling. But about 60% of why patients were calling in to schedule could have been prevented through an automated outreach workflow. Then the prescription or the way to implement a supporting technology was through outbound scheduling, where based on information in the system about a patient's need, we could then send an outreach and have them schedule. These are things like care gaps, orders, referrals, follow-up care, return to clinic or recall orders, to then allow the patient to self-schedule. So I'll go ahead and show you an example of what this looks like to make it real. In this example, the patient had follow-up care that typically someone in the call center would call out for. Instead, they receive a text message that says, "You're overdue for care, please click here to schedule." Upon clicking, the patient is now able to authenticate with their date of birth and last name. And after they do that, they're able to see some questions about the care that they are overdue for, answer those questions, and then be guided to the appropriate visit to schedule. So in this example, the patient is going to be guided to a screening mammography as opposed to a diagnostic, and then be able to schedule that appointment directly. And as you can see in this example, what we found with our partners is typically there is somebody sitting in and looking for either that care gap or finding that order or that referral. There's another person calling out to the patient. Oftentimes, the patient isn't reached until the second or third call out. So there's about 5 to 10 minutes of agent time on that first call, and then another 6 to 9 minutes to actually call and schedule that visit. And what we're seeing here is that when the patients receive the outreach digitally, all of that work is automated away. So that core underlying workflow is no longer needed for the patient who comes in, schedules that appointment, is now able to receive care. And if we go to the next slide, we can see the underlying or the kind of next, the ROI that's generated for the organization is eliminating a lot of these back-end work queues for staff while still using the EHR as the single source of truth. So all of this kind of administrative scheduling related burden is not required for patients that interact digitally. So with that, I'd love to talk to you about a partner overview. This is a blinded case study, but an organization we worked with that is a mid-sized healthcare system in the Southwest. They had strategic goals of improving patient and staff experiences, improving provider capacity and decreasing burnout, and responding to things like the COVID-19 pandemic with speed and agility. They had many challenges, things like a huge administrative burden coming from many manual processes associated with registration, patients dissatisfied with navigating the call center to manage their care, and then difficulty with existing digital tools and low utilization. And lastly, claims denials that were disproportionately driven by inaccurate registration data. So upon working with them, what we were able to accomplish was a large elimination in calls due to automating outreach for digital registration and appointment reminders. And this meant that call center agents were freed from managing these processes and able to handle patients with the most need. We were also able to measure and identify work queue reduction due to digital assistants performing manual tasks that would typically be in a work queue, and then reduce denials based on using things like AI-powered payer plan matching and patient data collection, which actually outperformed staff and reduced downstream denials caused by errors and typos. You can see here some of the statistics and kind of key KPIs that we worked with on this organization and the results that we were able to drive looking to automate these workflows away. So in sum, I'd like to leave you with a few different takeaways as you think about bringing automation to your call center, reimagining the role of the call center in patient access and operations today, and thinking through how novel technologies can help, and then thinking about your own automation assessment. The first thing is call center transformation requires organizations to pivot from thinking about marginal improvement of agent efficiency to fundamentally rethinking the workflow and reducing the number of calls agents need to manage. We've heard from multiple partners, they'll say things like, we are efficient, but we're not effective. We've worked really, really hard to meet these metrics, but we're using 4 to 6 people on the back end doing the same workflow to actually reach that metric, right? So we need to rethink marginal improvement and instead move forward to automating away the work entirely. The next key takeaway I'd like to leave you with is thinking through something like a digital front door powered by intelligent automation, which can address the reasons for most calls upstream and actually free up staff capacity for higher value work. And then as we think about, and you think about your own organizations, prioritizing which workflows to automate, it's important to focus on things like call volume, average mean time to respond, impact on patient experience, and revenue impact. And these are assessments you can do by seeing what types of calls are coming in and then seeing how these affect your organization. And lastly, another key takeaway is not to design tools for patients, for staff, for one constituency on the backs of another. So ensuring that technology approaches do not then create administrative burden and require more staff and more IT teams to manage the call center. So with that, I'd like to say thank you for listening in today, and I'd love to open it up for questions.
Great. Thank you so much for sharing how healthcare organizations can reimagine their call centers by leveraging intelligent automation to power patient access workflows. And thank you to our audience for your thoughtful questions. Please continue to submit your questions through the Q&A box. And if we're not able to answer your questions on the line today, we will follow up with you after the webinar. Awesome. Great. So the first question we have is, what are some common blind spots that you've seen organizations make as they automate many of the workflows that were previously managed through the call center?
Yeah, thanks, Lucia, and thanks for the thoughtful question. I think one of the key areas we see organizations struggle is they decide, yes, we're going to go in with automation, but they oftentimes don't know where to start. And there's this mentality of, okay, if we're going to do this, we need to go all in. And that could look like a big bang go live that takes maybe 18 months to 24 months, or we need to look at every single workflow. And I think that's why we focus on these best practices that we can use to find where the value is, and specifically the speed to value. We know in healthcare, oftentimes we sort of end up in kind of endless implementations often in the health tech space. And so what we look to do is, one, really use the 80-20 rule. Where are those kind of core automations that we can see most of the value from? And then we also look to say, let's start quickly with those highest value automations, get real-time feedback, iterate, and then grow out scale. And I'll give you one example. So one area we see this often is in orders, right? Most organizations will have hundreds of thousands or tens of thousands of orders in their system. But if you cut the data and you look at the analysis, really the top 30 to 50 orders are typically making up over half of every order that has been placed by a provider. So even though there are thousands and thousands of options, if you really look at just those top 30 to 50, which are typically less than 0.001% of all of the orders, right, they're going to be the most commonly placed. And if you automate those, as opposed to trying to automate every single order, you end up having a much more meaningful impact and much quicker than you will if you try to do everything at the same time. I think a second key piece is oftentimes organizations will say, before I do automation, I need to standardize my workflows, right, or streamline. And we hear this a lot with consolidation of practices or acquisitions of practices that said, okay, we have, every organization or practice within our group is doing something different. But oftentimes we can see automation as something that really helps to bring that engine. And that doesn't mean that it needs to be a, one that fits all. It can mean giving patients the options between a standard set of workflows, almost like how, oftentimes a marketing department will say, here's, 3 palettes you can choose from, one of these 3. We can do the same thing in terms of how we look to streamline and standardize our workflows in order to bring automation into them. So in sum, I'd say, you can start quickly with a small subset of workflows and then get real-time feedback and iterate, as opposed to going all in and spending a lot of time up front. And then the second would be, you don't necessarily need to wait to automate until you standardize. You can bring that as part of the process of automation.
Awesome. Thank you. Great. The next question is from someone who shares that they love the framework that you shared on how to assess the value of managing a call with automation as opposed to manual workflows. So complexity, patient impact, cost of error, and difference in performance. Do you recommend any changes in the approach for call centers that are decentralized versus those that are centralized?
Yeah, thanks, Lucia, and thanks for the question. This is an interesting one because most of these tasks, right, before there was a centralized call center model, tended to happen within the practice. So decentralized is kind of the baseline standard that we look at across healthcare. I would say that the framework still applies in either space, with maybe slightly higher emphasis on different areas. So with something like the decentralized version, where you have a lot of individuals doing this work across multiple practices or departments, we often see a higher emphasis on automating out, the work to allow staff to have greater capacity. So things that are really time-consuming, like outbound calls to schedule or to do pre-reg or authorizations, right? Something where you have fewer people doing the work. Pulling that work out and really automating a lot of those time-consuming processes is going to be really key, and doing that quickly. And then when we look at centralized systems, we often see a higher emphasis on reducing errors at a system level, because we have a lot more kind of individuals doing the same workflow. So in this case, it's things like routing the patient, looking at scheduling, providing those inbound and outbound ways for the patient to schedule their own appointments. And then things like insurance card, matching that payer and plan become really important in that centralized context. So I'd say the same framework still applies. We just kind of highlight or emphasize certain areas of the framework based on whether we're looking at a primarily centralized or primarily decentralized system.
Great. Thank you for sharing that approach. The next question is, what are the early success metrics that you recommend to measure impact?
Yeah, so with a lot of our partners, this is a conversation we have oftentimes, especially with the finance folks, right? Of how do we actually think about seeing that ROI, and what are the metrics we look at different parts in the project? And I had a CFO say to me the other day, things like staff capacity or reallocated staff, those tend to be more lagging indicators. So you'll see that maybe 6 months to a year into the rollout, right, once things are fully up to speed. I think that there's sort of maybe 3 buckets I'd bring out. And the first, in terms of early success metrics that we look at right when we go live, looking to automate, are things like conversion rates meaning how many patients are interacting with nudges or with the different kind of automated avenues we've made available to them. And then patient satisfaction. How are patients interacting? Are they having a good experience? Are they going to want to use this again and again? And I think those two kind of early indicators will let us know the success of patient adoption, patient engagement, and then seeing how much of that work is actually being taken away. So those are the kind of initial ones we'll look at in an early stage go live. The kind of next bucket of metrics I'd look at, maybe phase 2 or a little bit down the way, are things like work queue volumes. So are we actually seeing a reduction in work queue volumes, and number of inbound or outbound calls per month? I think those are both ones that we'll start to see within kind of month 1, month 2 of the project, and be able to say, oh wow, this work queue used to need 2 FTEs, now it only needs half time from that second FTE. Or we can really get granular on those inbound and outbound calls and start to see fluctuations. The reason I don't put it in the first category is, things like inbound and outbound calls per month, there could be other reasons why they're either, going up, going down. And so we'd want to get a couple months of data to really be able to definitively say, this is coming from the automation. And then, as I mentioned, those kind of later stage metrics that we still track, but are going to be kind of on maybe a QBR or every quarter cycle, are things like denials metrics, and then again, the kind of ability to reallocate staff somewhere else. So in sum, I'd say there's kind of 3 buckets of metrics. The patient satisfaction and conversion rates are going to be really valuable at the outset. Then things like work queue volumes and inbound and outbound calls per month. And then lastly, things like denials metrics or reallocated staff and percent capacity.
Awesome. Thank you. That was really insightful. Great. Thank you. Okay, great. So thank you to everyone for joining our discussion today. We hope you enjoyed and that you'll tune in for our upcoming webinar on October 31st, Solving the Staffing Crisis, How Automation Can Boost Staff and Patient Satisfaction. Thank you so much and have a lovely day.